Personality disorders. We will discuss about 4 personality disorders today: borderline personality disorder, somatoform personality disorder, psychotic personality disorder, and neurotic personality disorder. Let's take it one by one. Borderline personality disorder. The features of this disorder are unstable self-image, relationships or emotions, severe impulsivity that engages in risky behavior, mood swings, trouble with anger management, repeated suicidal or self-injuries, threats or behavior, chronic feeling of emptiness, inappropriate or intense anger, paranoia or disassociation. Features of borderline personality disorder, where a person is showing unstable self-image, relationships or emotions, is where a person is not able to sustain relationships with others. They are not able to sustain resilient emotions, and they are doubtful about the self-image. So they are not clear about the self-image. Severe impulsivity that engages in risky behavior. The person is very impulsive in taking decisions. The person is not a problem-solving person, and that might result into risky behavior. Mood swings are very common features of borderline personality disorder, where a person will show severe mood swings, sometimes very happy, sometimes very sad or angry. This disrupts not only their mental as well as their physical health. Trouble with the anger management, since the person is low on self-image and showing unstable emotions and unstable relation, the person is most of the time showing aggressive behavior and is having trouble with the anger management. So the self-anger management is very low in the patient. Repeated suicidal, self-injuries, threats, these kind of behaviors are very common in borderline personality disorder people, because the person is showing a weak emotional connect, and the person is very aggressive and showing lack of anger management. So this might result into suicidal tendency, the risky behavior where the person can get into the self-harm mode also. Chronic feeling of emptiness. Because of these features, the borderline personality disorder clients or patients, they have a consistent feeling of emptiness. Sometimes they can notice it and express it to the counselor. Sometimes they are not aware of it. That leads to major depressive disorder also. Inappropriate intense anger, as I mentioned, that they have issues with aggressive behavior and anger management. That leads to paranoia and dissociation with the society, with the self also. The treatment of borderline personality disorder is CBT, that is cognitive behavior therapy, and physiotherapy, where the person needs to focus on the lifestyle, on the health, on the oxygenation breathing techniques, and on the muscle relaxation techniques, so that the person can start associating with them, can start connecting with the self-image, and can start focusing on the emotional self. Somatoform personality disorder, a group of psychiatric disorders. Somatoform is a group of few disorders taken together. So we have to observe it for some duration and then come to the conclusion. So the diagnosis involves a group of psychiatric disorder in which patient present with a myriad of clinically significant but unexplained physical symptoms. So the patient will complain about certain physical symptoms which is clinically associated or significant but it will not be explained. So physically that is not actually present. The doctors found that after the diagnosis, the symptoms were not there. So the symptoms of somatoform disorder are persistent abdominal pain, headaches, joint pain, poor concentration, dizziness, moodiness, continuous worry about decreasing physical health, complete loss of body sensation or movements. So these are the symptoms the patient or the client will complain that they are facing these symptoms. Like the patient will come to you saying that I am not able to feel my legs, right? I am feeling that there are no movement in my legs. So clinically it is significant, it can happen, but when we do the checkup medically, it does not exist. The treatment for somatoform disorder are CBT, that is cognitive behavior therapy, breathing and relaxation workouts, that is advised for the client in proper guidance, walk or run in fresh air. The causes of somatoform disorder are anxiety, depression, trauma. Any trauma the client may have gone through in their childhood or faced in the past, that is stored there in their unconscious mind, or they still remember it. So that trauma can be a severe reason for somatoform disorder. Any medical condition like self-medical condition, or if somebody in the family is having any medical condition, that might result into somatoform disorder in the patient. Talking about the psychotic disorder, that is the loss of connection with the reality. It is described as a mental disorder that results into the personality disorder characterized by a disconnection from the reality. So the patient starts disconnecting with the reality. Psychosis occurs as a result of a psychiatric illness such as schizophrenia. Schizophrenia is a well-defined psychotic disorder where the patient stops connecting with the reality, and it happens in phases. It can also be caused by a health condition. The causes can be any health condition, medication, or drug use. Sometimes schizophrenia is also caused by some abuse or some trauma faced at a severe level. The symptoms of psychotic disorder are hallucination, delusion, diagnosed behavior of thinking speech, negative symptoms, that is no emotions, lack of interest in activities previously enjoyed, that is a major sign of depression, major depressive disorder. So the patient is also facing depression. Ungroomed appearance. Since the patient is not connected with the reality, the client is not connected with the reality, the client will not focus on the appearance, that is ungroomed appearance. So these are a few symptoms that last longer than 6 months. So we have to observe it in the client for 6 months. After that we can diagnose that the client is going through psychotic disorder. The triggers, as I mentioned earlier also, the triggers or the causes can be any abuse or trauma faced in the past or stored in the unconscious mind of the client. Physical illness or injury, it can be any physical illness, alcohol, smoking, any substance use. The treatment is CBT. When we plan the treatment for the psychotic disorder, before that we observe the client for 6 months, minimum 6 months for all these associations of the symptoms, and then get the client into the treatment. The treatment plan is CBT, that is cognitive behavior therapy. Occupational therapy is also very important, that is lifestyle therapy, where we encourage the client to focus on a regular routine, healthy lifestyle routine that is focused on food, workout, sleep, and proper oxygenation of the body, with a good breathing workout, strength workout, cardio workout, yoga, stretching, everything. Physical therapy, if the client has faced any physical illness or injury, this physical therapy is immensely important. Psychosocial intervention. So here we need to get into the psychosocial association of the client and then intervene in that and try to resolve that. Family therapy is extremely important. If the client is surrounded with the family people, we do group therapy, family therapy if required, or one-on-one family therapy also. If the client doesn't have anybody in the family, we will talk to the person who is close to the client, any person who is in close association with the client. If these therapies do not give good results, then there can be medical treatment of ECT, that is electroconvulsive therapy, or we put the client in under medication. Previously we spoke about psychotic disorder, where the client or the patient loses complete connection with the reality, gets into hallucination and delusion. So hallucination and delusion are two symptoms, basic symptoms, major symptoms that we observe in the client for psychotic disorder. Hallucination is a stage where a client imagines about certain event or people or anything that is not existent, that could be connected with the past experience of the client. Delusion is an association with something that is existing, but the idea of what is happening does not exist. An example of delusion can be that walking on the road, you consistently feel being chased by some people. That can be related with the past experience of the client. One more example of delusion can be your better half cheating on you. So the client might think that my husband or my wife is cheating on me. However, that is not the right case. One example of hallucination can be a client is sitting. What I observed with one of my clients is that the client was sitting with me, and client will imagine that a person is consistently interrupting him. That person doesn't exist, but the client will continue to talk with that person, that don't interrupt me and or don't hit me. So this is a very good example of hallucination where it doesn't exist, it's just a hallucination, the imagination of the client, and also it depends on the past experience or trauma the client has faced. Now let's talk about the neurotic disorder. As compared with the psychotic disorder, neurotic disorder client, they do not lose touch with the reality. They are very much connected with the reality. Neurotic disorders are the mental disorders that cover minor psychiatric disorders like stress, anxiety, depression, OCD, or phobia. The symptoms are anxiety and apprehension. So anxiety is the fear of performance or fear of doing something or fear of anything. Excessive worry, where the client starts worrying excessively, that is neurotic disorder. Tendency towards negative emotions. So what is that? A client is in a habit of getting into negative emotions all the time. That is the tendency of the client that comes under neurotic disorder. Irritability and anger, low self-esteem, self-confidence, or self-consciousness. Poor response to stressors or coping skills. What are the stressors? Like if you are getting stress due to some entity or due to some stimuli, those are known as stressors. So the poor response to the stressors or the coping skills are almost not present. For example, in the poor response to stressors, if a particular event or incident or any person is causing you stress, the client is not able to handle it. That is known as the poor response or lack of coping skills. Depression, the client starts losing interest in the activities that he or she used to enjoy in the past. Various other depression observation. Self-consciousness or shyness, that is also one very important symptom of neurotic disorder. Now let's talk about the causes of neurotic disorder. Talking about the biological, the violation of metabolism of neurotransmitters results into neurotic disorder. Hormonal imbalance, that can happen by birth, by genetic, or due to poor lifestyle. Vitamin imbalance, again it can be largely due to poor lifestyle. Imbalance of biological substance responsible for normal functioning of central nervous system. So this is again it can be genetic, biological, or it can also result due to poor lifestyle. Few types of neurotic disorder are anxiety neurosis, depression neurosis. So anxiety, stress, depression, these are very common neurotic disorder where the client is completely connected with the reality, the real world, but the client is showing these symptoms. OCD is a major neurotic disorder, obsessive compulsive neurosis. The treatment is again psychotherapy, where we put the client into relaxation workouts. If the client is able to manage strength workout and cardio, easy cardio, or any cardio that as per the client's fitness levels, breathing workouts are really important to oxygenate and to balance the neurotransmitters. A complete structured workout training. If these therapies do not give good results, positive results, then the client is put into the medical zone. With the help of medicines, the client is advised to take help of a psychiatrist and take medicine.